Hey guys, it's Dr. Anderson, Life Essentials Chiropractic in Missouri City. Today I want to talk to you about an exercise that we do a lot of times with our members called cervical traction. So when you do spinal correction, we want to take into consideration the disc and ligaments that are involved in the connective tissue as well as the spine, right? So before we adjust you'll a lot of times see patients doing this cervical traction exercise. And it's really important because it can actually start to warm up and soften the really hard tissues as she's going up and down. She's lengthening, decompressing pressure from the joints. It helps pump and hydrate the disc. The disc is 80% water, and it's like a pumping mechanism that when the joints stop going through their normal motion and become misaligned and stuck, there's no more pumping. And it's sort of like a kitchen sponge that was full of water, and then it became like a kitchen sponge that was laying on the counter for a few weeks that was all hard and shriveled and crackled. And that creates disc injuries, disc degeneration and breakdown, swelling. It also creates a direct nerve decompression. And when the nerves control everything in the entire body, it also creates stimulation to your vagus nerve, which is a hot topic. It's one of the master controlled nerves of every major organ system of your body. Gets benefit, heart rate, digestion, blood pressure, respiration. It helps create a calming neurologic effect in anti-fight or flight and stress neurologic effect, all just from working with the central nerve system and the nerve roots related in the neck. So this is something that you might see when you come in the office. This is something that's a critical component. If you have any sort of issues in your cervical spine, you get way more of an effective adjustment out of your spine when you go through cervical traction first.